Welcome to this informative video on temporal bone fractures affecting the inner ear and their impact on vision. The temporal bone, located at the base of the skull, houses the intricate structures of our inner ear, responsible for both hearing and balance. Fractures to this area can have far-reaching consequences, including visual disturbances. Join us as we explore the causes, symptoms, diagnosis, and management of this complex condition, and how it can affect your sight. Temporal bone fractures are typically caused by significant blunt force trauma to the head. This can occur from motor vehicle accidents, falls, assaults, or sports-related injuries. The severity and direction of the impact determine the type and extent of the fracture. Even seemingly minor head injuries should be evaluated, as some fractures may not be immediately obvious. The inner ear, nestled within the temporal bone, contains the cochlea for hearing and the vestibular system for balance. When a fracture occurs, it can disrupt these delicate structures. Damage to the vestibular system can lead to vertigo and nystagmus, involuntary eye movements. This nystagmus is the key link to vision problems. The brain interprets the disrupted balance signals as movement, causing the eyes to oscillate in an attempt to compensate. Further, fractures can directly damage the facial nerve, which controls some of the muscles around the eye, causing weakness or paralysis. In rarer instances, fractures can indirectly affect cranial nerves involved in eye movement control. Epidemiologically, temporal bone fractures occur in a small percentage of all head injuries. Precise figures vary based on the population studied and the reporting methods used. It's more common in younger individuals due to their higher participation in activities that carry a risk of head trauma. However, older adults are also at risk due to falls, especially if they have osteoporosis or other conditions that weaken their bones. The signs and symptoms of a temporal bone fracture vary depending on the location and severity of the fracture. Common symptoms include hearing loss, tinnitus and ringing in the ears, vertigo, a spinning sensation, and facial weakness or paralysis. Related to vision, patients may experience blurred vision, double vision diplopia, due to nerve damage affecting eye muscle control, or nystagmus, which makes it difficult to focus and can lead to a visual blurring effect. Fluid drainage from the ear, either blood or cerebrospinal fluid, is also a serious sign. The presence of a bruise behind the ear, known as Battle's sign, is another indicator of a temporal bone fracture. Diagnosing a temporal bone fracture typically involves a thorough physical and neurological examination. The doctor will assess hearing, balance, and facial nerve function. Imaging studies, particularly a high-resolution CT scan of the temporal bone, are crucial to visualize the fracture and identify any associated injuries. An audiogram, a hearing test, is performed to evaluate the extent of hearing loss. Vestibular testing can help determine the severity of balance dysfunction and confirm the presence and type of nystagmus. In some cases, an MRI may be used to assess for soft tissue injuries or damage to the cranial nerves. Temporal bone fractures are often classified based on their location relative to the petrous ridge, a bony prominence within the temporal bone. Longitudinal fractures run parallel to the petrous ridge and are more common, often affecting the middle ear and causing hearing loss. Transverse fractures run perpendicular to the petrous ridge and are less common but more likely to damage the inner ear and facial nerve. There are also mixed or complex fractures involving both longitudinal and transverse components. Treatment for temporal bone fractures depends on the severity and associated injuries. Mild fractures may only require pain management and close observation. More severe fractures often necessitate surgery. Facial nerve paralysis may require surgical decompression of the nerve. Hearing loss might be addressed with hearing aids or, in some cases, cochlear implantation. For vertigo, vestibular rehabilitation therapy can help the brain compensate for the balance dysfunction. If cerebrospinal fluid is leaking, surgery may be needed to repair the dural tear and prevent meningitis. Visual disturbances like double vision may require prism glasses or, in some cases, surgical intervention to correct eye muscle misalignment. Medications to suppress nausea and vertigo are often prescribed during the acute phase. While it's not always possible to prevent traumatic injuries, taking precautions can reduce the risk of temporal bone fractures. Wearing seatbelts in vehicles, using appropriate safety equipment during sports and recreational activities, and preventing falls at home are all important preventive measures. Fall prevention strategies are particularly crucial for older adults. Workplace safety regulations and adherence to them are also critical in preventing injuries from falls or machinery accidents. The prognosis for temporal bone fractures varies widely depending on the severity of the injury and the presence of complications. Some individuals recover fully with minimal long-term effects. Others may experience persistent hearing loss, vertigo, or facial nerve paralysis. The visual disturbances linked to these complications can also be long-lasting. Recent research focuses on improving diagnostic techniques, developing more effective surgical approaches for facial nerve repair and hearing restoration, and optimizing vestibular rehabilitation protocols. Researchers are also exploring the potential of regenerative therapies to repair damaged inner ear structures.